Now, this is where I think we're starting to head into what I've called before a mediocracy. Not a democracy, but a mediocracy, and there's a deliberate pun intended there, a mediocre state of affairs where health bureaucracies are now running the country, and they're saying, well, we will decide what's healthy for you. In my other role here at Flow, when I'm not on the morning show, I'm on the Flow News 24 desk, and we've been chasing up this statement that Victoria's Premier Daniel Andrews made on the weekend on Sunday, saying that people who were not vaccinated would be denied access to Victorian health services. We've contacted the Victorian Government, the Health Department and the Premier, asking whether this means that if someone is not vaccinated, will they be denied access to an emergency department in a Victorian public hospital, and will they be denied access to an ambulance? And if that is going to occur, at what time is that going to occur? People might want some warning if they want to get vaccinated before they're going to be denied access to public health services. Now, the only response we've received to that inquiry is from the Health Department, which doesn't actually answer the question at all. All they've said is, we want to make sure people are vaccinated. That's my paraphrase, but we've been reporting that on the Flow News 24 service on our radio audio services. But when you look at the response from the Premier, it's missing. There's nothing. And we've gone back and asked the Premier again for a response to that question. We've also asked the World Health Organisation what their view is on the denial of health services. Now, you see, denying health services is breaching a human right. Australians, and in fact people all over the world, have the right to access health services. So just because someone chooses not to get vaccinated, now the Premier has said you will be denied access to health services in Victoria if you do not have an excuse to do so. So we've carved out those people who on health grounds might not be able to get vaccinated. But there might be people who, for instance, may well be adults, but they may be living still at home and still in a parent-child situation where they might be pressured or influenced to believe that they shouldn't get vaccinated. So they're relatively still young. They maybe don't understand, what's being said about the coronavirus. Maybe they are reading things on the internet and they really are indecisive. I mean, let's not forget, premiers turn up at press conferences every day to say things, but that doesn't mean everyone in the state is hearing them. Not everyone's listening to the mainstream media services or even listening to Flow FM. They might not be listening to any at all. They might be head down, backside up, working hard to try and earn a living or just keep a roof over their head, and they're not listening to the Premier or anyone else. So I think there is a very concerning development here when public health services are going to be denied to people who might, for their own reasons, whether the Premier believes they're legitimate or not have got themselves vaccinated. Now, there's a story developing in New South Wales, being promoted by James Morrow in the Daily Telegraph, suggesting that in an apartment complex for people who are in a social housing environment, people that are sending them care packages or help while they're isolating, if there's more than a 6-pack of beer going into that premises, then the rest of it is being tipped down the drain. Now, this is where I think we're starting to head into what I've called before a mediocracy. Not a democracy, but a mediocracy, and there's a deliberate pun intended there, a mediocre state of affairs where health bureaucracies are now running the country, and they're saying, well, we will decide what's healthy for you. Now, there have been in the past pushes by the Greens and others to have sugar taxes and fat taxes and the like, and these are all driven by doctors' concerns about people putting things in their bodies that are not healthy for them. Where does this mediocrity end? Where will it end when it comes to people who are being told, well, you can only have a limited amount of alcohol because we're controlling your environment? I mean, prisoners have that sort of control over what they're allowed to eat and drink and do and put inside their bodies, but we're not prisoners in Australia, not since 1788, I believe. Most of us here are free people. So people that have been hitherto free to put and do whatever they do on their bodies and in their bodies. So are we going to be in this mediocracy, this health governance, where now a lot more choices are going to be made for you about what's healthy for you? If we're going to eliminate, for instance, death altogether, then we're going to live in something similar to re-education camps that have been featured in some of the terrible regimes in the world, where people are going to be controlled about every choice they make. And that's not the Australia I grew up in. It's not the Australia I've lived in, and it's certainly not the Australia I want to live in.